Good afternoon, I'm Ian Gannon.
And I'm Jennifer Sanford, and welcome to OTP News.
Today our topic of discussion is spinal cord injury, and as you know, December is Spinal Cord Injury Month, and we would like to bring awareness and encourage others to increase their knowledge about spinal cord injuries.
Some people you may remember with spinal cord injuries were Christopher Reeve. Christopher Reeve was known as Superman, and he suffered a spinal cord injury but was very active in lobbying, and then he soon passed with cardiac arrest.
Jim Abbott is also a famous baseball player that suffered from this disease, and he won a gold medal and a no-hitter with his time in the major leagues. He never played small league baseball, but he jumped from university ball to the major leagues immediately. He was one of the best pitchers during the 1990s.
So you may be wondering, what exactly is spinal cord injury? Well, a spinal cord injury is a lesion, meaning damage or disease, affecting the spinal cord that results in partial or complete loss of neurologic function from the site of the injury to everything below the level. Lesions can be complete with total severing of the cord or incomplete with partial severing of the cord, and damage can be temporary, but most often permanent.
Spinal cord injuries results in quadriplegia or paraplegia. Paraplegia is the paralysis of the lower extremities with some involvement of the trunk and hips depending on the level of the lesion. Quadriplegia, also known as tetraplegia, is partial or total loss of all their limbs and torso. Paraplegia is similar but does not affect the arms.
Well, what exactly is the difference between quadriplegia and tetraplegia?
Well, I'm glad you asked, Jennifer. Originally, tetraplegia was the main phrase that they used for it in Europe and around the world, but the Americans coined it quadriplegia, quadra being Latin for four, plegia being Greek for paralysis. So tetraplegia, tetra being Greek for four, plegia being Greek for paralysis, is the international term that they use to recognize this disease.
Okay, so now that we have the basics, let's go ahead and join April and Liz at our FSCJ clinic.
As your viewers may remember, we did a profile on Liz several weeks ago. Liz suffered a T1 spinal cord injury, and that basically means that she has no sensory or muscle function from about here down. And when we were talking with Liz back then, we were talking about meal preparation, getting her to be independent in her life roles and responsibilities so that she could be confident in those when she returned home. Basically, achieving the maximum level of independence is the overall goal of occupational therapy in an injury like Liz's. So that being said, Liz, how did OT work out for you? Did you find it helpful?
It was great, yes. I was really, I learned a lot from our sessions, especially about ADLs and how to cope in the kitchen, using small appliances, and I have a chopping board that sits on my knee, which I still use, so that was awesome. We also talked a lot about joints,
Joint protection?
Joint protection. So not overusing my joints. And a friend of mine's just blown out his rotator cuff muscles, so he's going to have to go to an electric wheelchair. We also talked a lot about skincare and pressure relief, which I know is really important. I see that on the online community. So I'm really grateful I got the OT I did. Thanks.
Well, I'm glad to hear that OT was helpful for you and it's helped you to be more independent. I know we did spend a lot of time on pressure ulcers, but it is important for us to stress how it is to follow your pressure relief schedule and do everything possible to prevent those ulcers because they can be very costly and, more importantly, very, even life-threatening. And I'm also glad that you brought up the subject of joint protection. Like so many other people in a manual wheelchair, your arms are having to do a lot more work than they were before, and it's important to consider joint protection so that your arms and hands remain as functional as they can. Wrist injuries and rotator cuff tears can really limit your independence. So sometimes we try to talk to clients like you about some of the advantages of having a power wheelchair. Basically, you're using a lot of energy and you're stressing your joints a lot. Even just, getting from point A to point B, using a power wheelchair would allow you to use those kinds of, use that energy in other meaningful occupations?
I'm not so sure I'm happy with the image of me in a power chair. I really like my manual and it moves around really easily, so I have to think on it for the future.
I do understand how you feel, and it's definitely a personal decision. I just want to make sure that you have the information and the perspective to see some of the advantages that a power chair could offer to you, even if it's just for part-time use. So another thing that our viewers may not remember is that you were a student before your injury. Are you now back in school, and how are you getting to and from your classes?
I am. I'm back at FSCJ, which is very accommodating for people with spinal cord injuries or in wheelchairs. It's heavy going. I'm more tired than I thought I was going to be. Getting back and forth has just become easier, and I'm going to give Mobility Works a plug. They're on St. John's Bluff, and they just adapted my car, so I can now drive independently, which is awesome.
That's great. I'm so glad to hear that you are now independent in your community mobility and that you're back in school and doing the things that are important to you. That's great to hear. Are there any other issues that you would like to share with our audience today?
Well, I'd love a complete bathroom renovation, but who wouldn't, you know? I think on a more serious note, it's a big life change, and certainly back then in the acute phase, everyone was telling me, and I thought so too, that losing my mobility and the ability to walk would be the biggest thing I'd have to cope with. But in reality, that's not been the case. I think issues like dealing with my bowel and bladder, my diet changes, and an autonomic dysreflexia, which I had one bout of, is very serious. And it's those things that have been a lot harder to cope with.
Well, thank you for sharing your story and allowing us to catch up with you, Liz.
Okay, nice to see you again.
You too.
Thanks for joining us, April. It was really good to see how Liz is progressing.
Thank you. And yeah, I'm glad to see that she's doing so well. And I do still want to talk about some of those issues that she brought up at the end of the interview.
Okay, April, well, let's take a look at more of those areas of concern after this quick commercial break.
As technology improves, so does the quality of our lives. Whether it's comfort, convenience, cost, or a combination of all three, companies are working around the clock to make sure that the basics in your life are covered.
Mobility Works is a business that totally focuses on helping people who are in wheelchairs get out and stay active, giving them freedom to live their lives. When you're in a wheelchair, small things can make a big difference. It can be really difficult to get from their wheelchair into another seat, and so you have to live it and try it. They're just like you and me. We help people live life to the fullest.
The Intimate Rider works for men with spinal cord injury. Discover new positions and a natural gliding motion for a better sexual experience. The Intimate Rider promotes pleasure and is safe to use. Go to IntimateRider.com to hear what real couples are saying about their Intimate Rider experience.
We'd do something and she'd say, oh, wait, let's try a different position, or let's, you're hitting the magic spot. You know, when I hear that, I'm thinking, hey, yeah, I'm the man.
To get your Intimate Rider, go to IntimateRider.com today.
And welcome back to OTP News. Here's April with more of those areas of concern we talked about earlier.
Thank you, Ian, and I'm glad that we're going to get a chance to talk about some of the things that Liz brought up. I feel like a lot of us in the OT field believe that there needs to be more emphasis on these areas of a person's life. Some of these issues can be a little uncomfortable, and we need to be treating holistically. Addressing areas like bowel and bladder and sexual function really help to empower these people to live their lives to the fullest. So there are some clients who have spinal cord injuries that are at a higher level than Liz's, so they have some more impaired function in their hands. And I have a video of a guy who shows how he does his setup for his bowel and bladder program.
I'm a quadriplegic C5, just showing you how I do self-catheterization. I had the option of getting a suprapubic catheter, but I just think for independence it's a lot easier to do self-catheterization, and it's also less bladder infection. And with this kit that I've got, it's actually quite easy to do it yourself. So first thing I would do is roll up my shirt, then loosen my pants with this clip I've got. And then obviously I'm not going to do self-catheterization on camera, but I will show the method. This is a pant clip that I found very handy, and I can do self-catheter without it, but this just makes it a whole lot easier. Okay, so you unclip it, looks pretty much like that. Okay, and this hook at the top here would hook into your pants. So I'll just hook the top layer of pants, not the whole thing. Okay, so that'll hook in your pants like this, and you push this part under your wheelchair. Okay, and then it holds your pants open, as you can see. Obviously this area here where you can see the black underwear I'm wearing, obviously I would be nude. Then you get your bladder bottle, which I've put Velcro underneath, and the matching Velcro goes on the other side of the pant clip. So that will just stick just like that. Okay, so you don't need to hold the bottle and you don't need to hold your pants open.
Wow, that Velcro really is a smart idea.
Yes, sometimes it's the clients who come up with these great and clever ideas.
Exactly. I have another video of a man who came up with his own simple idea for closing the doors in his home, and some really simple solutions for helping him to be able to do his laundry independently.
As I go into the house, I just open up this door. I wanted to show you that I actually added this handle right here. That makes it a lot easier for me when I'm coming out of the house, just to grab that. I don't have to try to reach all the way in to shut the door. So when I go in, I just obviously push it open. If you want to come on in, this is the laundry room that I had widened a little bit. I had mentioned earlier this wall was pushed out about a foot, which now that you're in the laundry room, you can see how much of a difference that makes. Turn it around, especially when there's not a dog in here. I've got my front-loading washer and dryer that have these pedestals on the bottom. I had these mounted so the doors will open out from one another, which means I can just sit here, basket on my lap, transfer it into one, and then just kind of toss it into the other. I don't have to shut one to open the other. So that's really handy. Another thing I never really thought about when I got these pedestals was the fact that if you think about it, I don't have any storage under my sink in my kitchen. I have a little pantry in there. So these came in really handy for just cleaners, cleansers, bags, basically whatever I wanted to put under here. I have plenty of room. Obviously I can't use these shelves very much up here, so that's come in really handy. I don't think I've touched that in a long time. I just kind of label stuff in case I ever need it and get somebody else to pull it down.
Wow, that was really innovative and smart.
So it looks like there's really a lot of options available to help these clients live as independent as possible. What other kinds of devices are out there?
One really cool piece of equipment is something called a tenodesis splint, and I have yet another video. This one's of an occupational therapist demonstrating how the tenodesis splint actually works.
The field of prosthetics is actually a field that encompasses both prosthetics and orthotics. A prosthetic is a device that replaces a missing body part, whereas an orthotic is something that modifies the function of an existing body part. For example, my artificial leg is a prosthesis, and this device is one example of an orthosis. This device is a tenodesis splint, or a wrist-driven hand orthosis, and it's meant to augment the pinch grip in your fingers of a person who has very weak pinch grip, but who has really good wrist flexion and extension. It's really useful for people with C6 or so spinal cord injuries who have really good wrist flexion and extension like this, but who have really poor pinch grip. When a person extends their wrist, it pinches their fingers, and when a person flexes their wrist, it unpinches their fingers or opens their fingers. hand in here like this. Now when I flex my wrist, it opens my hand, and when I extend my wrist, it closes my hand and offers an ability to get a pincher grip that if I were a person with a spinal cord injury, I wouldn't be able to do without the orthosis. I also can change where it opens and closes with this little button right here. Anyway, these are custom made to each person, and this was not made for me, so you can see that it actually doesn't quite fit me right. There's a little bit of space here that if this were made for me would be closed up, and my thumb is a little bit smaller. You can also see it's got loops here and here in order to enable somebody with limited grip strength to be able to put on this device independently. Anyway, for those of you who are healthcare professionals, I thought you might enjoy this little tutorial on what a tenodesis splint is. And for those of you who are just curious, I thought you might think it was a pretty cool little contraption. It really enables people to be able to do a lot of things that they couldn't otherwise do. And for those of you who are going into prosthetics or orthotics, you might get to make one of these one day. And so I thought you might like to see one in action.
Precautions for occupational therapy assistants working with individuals with spinal cord injury include range of motion precautions. Clients with an unstable vertebral column should not receive range of motion of shoulders beyond 90 degrees or manual muscle testing of shoulders or scapular muscles until they have been cleared by their physician. Do not overstretch long finger flexors or wrist extensors, as this can reduce tenodesis action and reduce function. More on this later. Be aware of symptoms of autonomic dysreflexia. These include flushing, sweating, slowed pulse, sudden headache, and sudden and dangerous rise in blood pressure. Patients should be positioned upright and checked for the cause of autonomic dysreflexia, which is usually bladder or bowel distension, but could also be skin irritation from tight clothing, leg bag straps, or pressure areas. Do not recline the patient. Know and discuss the respiratory precautions of your patient with the nurse and respiratory therapist before beginning treatment. Observe skin breakdown precautions. Take care not to drag the skin when repositioning the patient. Patients in bed should be turned and repositioned at least every 2 hours, and seated patients should perform chair shifts every 15 minutes. Understand temperature precautions. Higher level spinal cord injury patients cannot regulate their body's temperature, and they need to be kept artificially warm in the winter and cool in the summer. Be aware of the symptoms of heterotrophic ossification. Reduced range of motion, redness, pain, and swelling around the joint indicate this condition and must be reported to the physician immediately. Some treatment techniques for occupational therapy assistants working with this client group include patient or caregiver education in positioning, range of motion, use of proper body mechanics, the importance of skin care to minimize breakdown, proper use of adaptive equipment, the need for increased awareness of sensory deficits, the importance of setting realistic goals, effective methods for handling architectural barriers, symptoms of autonomic dysreflexia and orthostatic hypotension, and sexual counseling. Occupational therapy assistants also work on increasing strength and endurance of upper extremity muscles and improving the patient's performance in coordination and dexterity. This is where you may recommend orthotics if appropriate. Occupational therapy assistants also improve the client's mobility status and work on the patient's functional independence in ADLs. Occupational therapy assistants also have a big role in managing spasticity, and it's important to understand that increased tone in certain muscles may actually increase function. One example of this is tenodesis. As stated earlier, you do not want to overstretch long finger flexors or wrist extensors, but you should still provide passive range of motion to keep the joint capsules free. Here is a demonstration of how to provide passive range of motion while encouraging and maintaining tenodesis. With the wrist in neutral, range the IPs with the MPs flexed at 90. Range the MPs with the IPs flexed. And then flex IPs and MPs together to make a fist. You may also utilize splints that will maintain the web space, encourage opposition, and prevent overstretching of wrist extensors when appropriate. Some examples of these can include the short or long opponent splints.
Thanks for joining us, April.
Advances in research are giving doctors and people living with spinal cord injury hope that spinal cord injuries will eventually be repairable. With new surgical techniques and developments in spinal nerve regeneration, cell replacement, neuroprotection, and neurorehabilitation, the future for spinal cord injury survivors looks brighter than ever.
We want to give a special thanks to Liz and April at the FSCJ Clinic, and thank you for watching OTP News. I'm Jennifer Sanford.
And I'm Ian Gannon. We'll see you tomorrow at noon with more breaking interventions. Nice, guys.
Woo!
I think that's
We're out of here.
We graduated.